Over Grey's Anatomy's almost 20-year reign, there have been several talented surgeons who have stepped up to the prestigious Chief of Surgery position, but only one can be considered the best. The Chief of Surgery at Grey Sloan Memorial is not only regarded as the top surgeon, but also has several managerial responsibilities, and acts as the Chief of Staff for all the other surgeons. As a result, the Chief of Surgery always has an increased narrative role in Grey's Anatomy during their tenure in the position. The decisions that the Chief of Surgery makes directly impact every attending and resident surgeon, as the position also puts them in charge of the hospital. A large part of the role involves delegating funding to different programs and making administrative decisions that can make the lives of their colleagues harder. As several Grey's Anatomy characters have realized, the position is not for the light-hearted, as it is considered one of the most stressful jobs at Grey Sloan Memorial. While the job is highly sought after, it is not for everyone. 9. Dr. Preston Burke. Interim Chief of Surgery in Season 2. Preston's time as the interim chief in Grey's Anatomy Season 2 was not entirely bad. However, it is not a memorable moment in the show which places Preston at the bottom of the series' chief's roster. Dr. Burke takes over after Richard has brain surgery and is meant to replace Richard after his retirement, but this never happens. Ultimately, the personal storylines concerning Preston remain far more prevalent in Grey's Anatomy fans' minds. Preston is an excellent surgeon and conducted a risky surgery on a familiar favorite during his tenure, which shows off his valuable skills. However, the difference between his example and Richard's is too noticeable to ignore, which ultimately works against him and leads to him losing the position he strived for. He is only in the position for 2 episodes, but his impact is insignificant. 8. Dr. Derek Shepherd. Chief of Surgery in Season 6. While Derek is only the chief for 1 season, his tenure in the role is considered one of the worst examples of anyone in the position. Derek becomes Chief of Surgery after Richard steps down to get alcoholism treatment, but Derek's heart is not in it. He wanted the position for its prestige but did not appreciate the role once he had it. The position has a significantly larger amount of administrative work attached to it than surgery, which leads Derek to feel dissatisfied with his work. Derek is also one of the worst chiefs of surgery because of how he handles his promotion. When he finds out that Richard has been drinking on the job, Derek goes above him to tell the hospital's board about Richard's addiction, despite Meredith's pleas not to. While he was right to do so, this betrayal proved that Derek was interested in calling out Richard for his own interests rather than for the good of the hospital. 7. Dr. Mark Sloan. Interim Chief of Surgery in Season 8. Eric Dane's Mark Sloan is also not necessarily one of the worst chiefs of surgery, but his short tenure did not give him much room to become the best. Mark becomes the interim Chief of Surgery for 1 day in Season 8 when Owen takes the day off. Mark's short tenure makes him one of the most amusing chiefs of surgery, but he also has several problems that stopped him from becoming the best. Mark's charisma, genuine care for his patients, and his ability to push Derek to be his best gave him the potential to be one of the better chiefs of surgery. However, Mark lacked the experience to realize what it meant to be a good chief of surgery. When Mark oversteps his role to stop Richard's planned transplant surgery, Richard quickly tells him to stand down and that what seems perfect is not always the best choice for the patient. Despite Mark's errors, he had a strong potential to become a great leader if he were given more time. 6. Dr. Miranda Bailey. Chief of Surgery from Season 12 to 18. Bailey is vital to Grey's Anatomy and the function of Grey Sloan Memorial, which makes her a memorable chief as well. While she makes some amazing decisions as chief throughout her reign between Seasons 12 and 18, her character also experiences significant changes and stresses that impact her work ethic. Bailey was a great chief, but she often seemed to let the stress of the job get to her and took it out on her attendings as a result.